Have you heard of him yet? If not, then meet Padmashree awardee Professor Dr. J.M. Hans, a topper and medalist from Chandigarh Postgraduate Institute of Medical Education and Research, who has done pioneering work in the field of cochlear implant surgery and has more than 1,500 successful cochlear implants to his credit. Dr. Hans further elaborates on the type of hearing aid devices.
The child starts hearing inside the mother's womb after the 7th month. So actually we should be implanting him as soon as the child comes out of the mother's womb. And we can actually determine hearing loss of a 1-day-old child. We have gadgets by which we can do that. Yes, we don't do that because there are 2 categories in which spontaneous recovery of hearing can occur. That is the delayed myelination of the auditory nerve and auditory dysynchrony. So that's why we have to wait for about 8 months or so. And that is a time when the skull also forms well, so that we can put the implant onto the skull. So there is one device which we implant inside, that as a surgeon I do, and one device is put outside which has the microphone, the battery, and through radio frequency the outer device gives it to the inner device. That was done, switch on was done just now upstairs you saw, and that is the first reaction of the child after the implant. So there are a group of people. I mean, it starts from Bretley, who educates people. It then comes to me, I operate, and then it comes to the habilitation and the switch on people. So it's a big teamwork to make these children normal. There are many, but at the most the best one we have is Nucleus 6 with Scanzo. So that's a beautiful device, very small. You hardly see it on the skull, and it can be hidden by the hair. So it's one of the most beautiful devices available.
Joining hands with Dr. Hans and championing for this brilliant cause is former Australian cricketer Brett Lee. Lee, who has been appointed as the global brand ambassador of Cochlear, the hearing implant maker, said it was an initiative to spread the word about these treatments to the public.
Firstly, it's great to be back over in India, here on behalf of Cochlear, and obviously here with Dr. Hans, who's a legend of the industry, has done over 2,000 surgeries on children and people here in India. Look, to me, my role as a global ambassador for hearing loss and working with Cochlear is to spread awareness and to make sure that everyone should have the same opportunity as when I was born. I was born with normal hearing, very lucky, but a lot of children around the world aren't. There's 360 million people around the world with some form of hearing loss. So we want to make sure that every single child has got the same opportunity as when I've grown up.
Dr. Hans, who had pioneered the minimally invasive technique for cochlear implantation in India, has facilitated more than dozens of children with hearing. A family from Afghanistan in particular described their child's journey of going through the cochlear implant.
First of all, I think cochlear implants are just amazing, and that has changed my children's life a lot. Without cochlear implants, they wouldn't be able to go to school or learn the languages. When we realized that Maria was having the hearing problems, we did some research to find out that where to do the medical treatment. And of course, in my country, in Afghanistan, when it comes to medical treatment, the first country that comes to mind is India. So in India, I just began asking my friends who would be the best ENT surgeon to do Maria's cochlear implants, and of course Dr. Hans' name was the first that everybody recommended. And so he did Maria's first cochlear implant when Maria was just 10 months old, because we didn't believe that this device would really work. But that worked amazingly, so that's why we planned for the second year when Maria became around 2 years old. And when Musa, my son, who is now 22 months old, was diagnosed with severe deafness and profound, we knew that what the solution would be, which is cochlear implants, and of course we already had the name, which was Dr. Hans, and so we contacted and all the things were done here. I think it was very successful, and the surgery, in my opinion, it wasn't a major thing, because he did it so easily.